Right, we're going to kick off, everybody. Welcome to NAPCAN's 5th webinar in the National Child Protection Week series, Putting Children First in Queensland. My name's Rob Ryan, and I'll be chairing today's session. So National Child Protection Week is a perfect time to focus on prevention, especially in 2020 when it's celebrating its 30th year. It's also a time to acknowledge the many people who work and volunteer in Australia to make Australia a better place for children, young people and families. For me, this is my 26th year being involved in the child protection sector, and I'm really delighted today to be joined by 3 individuals who are incredible. I know they're going to prompt your thinking and fill your mind with lots of great ideas. So whether it's your 30th year or your first year, I'm really glad that you can be here to be part of this important conversation. I know that the Honourable Di Farmer's done a lovely acknowledgement of thanks and commitment for the opportunity today, and because we're basing this out of Queensland, that's gone onto the NAPCAN website that people can look at later. And she wanted to personally thank everybody in the sector for their drive, dedication and positive impact on children, young people and families, as does the board and executive of NAPCAN, who wanted to congratulate everyone on 30 years of Child Protection Week. There's always much more to do, and we always know that there is more that we can focus on in prevention, but the journey that we've come along in 30 years has been impressive, and we can see that in the next 30 years, many things will have changed for the better. So I'd like to start by acknowledging and paying my respects to the Yagara people and the Turrbal people on the land on which we're meeting here today in Brisbane, and also to those who are joining us from all the locations across Australia, and also our colleagues in New Zealand who are joining us today. And I'd like to pay acknowledgement to elders past, present and emerging. And for those people who are joining us who are Aboriginal, Torres Strait Islander, thank you for joining us on the webinar today. So we're going to move through fairly quickly, just a little bit of housekeeping to get the ball rolling. If you're like me and paranoid about mute buttons, videos, etc., don't worry, you can't unmute yourself or turn your camera on. That's all being managed back of house. If we do run into any technical difficulties, we've got somebody on NAPCAN who can actually assist. And if GoToWebinars is new to you, you'll see that the control panel is on the right-hand side of your screen. We've got questions and chat functions are enabled, and we've got hundreds of people online today. So the speakers have quite limited time. So we're going to just go through, I'll introduce the speakers, they'll present, and then after each of the speakers finish, we will then move through to the next speaker, and then we'll take all your questions during the course of the conversation. And if we have time at the end, we'll follow those questions up. We will keep track of all the questions. If we don't get a chance to finish them, we will provide some responses from the panelists after today. Also, some of our panelists have handouts, and if they do have handouts, they'll be available on the control panel on your screen, or they'll be sent out to people as well. And some of the panelists will be having some video PowerPoint presentations, which will come up as well. And at the end of today, there'll be a follow-up survey, so your feedback would be very much appreciated. So just before we start, I'd like to give you some context about today's program. So the ambition for this event was rather significant, and that is we wanted, in an hour, to find ways to inform practice in Queensland by looking at different systems levels, opportunities and what they mean for children. So we're starting by looking at the innovative New Zealand Child Wellbeing framework and figuring out and looking at contemplating how that could be applied to an Australian situation. And we have Judge Andrew Becroft, who's the New Zealand Children's Commission, who's kindly agreed to join us to talk about his work in this area. We then wanted to look at a community level, and so we're joined by Professor Sharon Goldfeld from the Murdoch Children's Research Institute, and she's an obvious choice to talk about this topic, and she'll be looking at important areas for child wellbeing. And then finally, we've got a local example of how we can engage different groups, such as the private sector, who may not have traditionally seen themselves as part of this solution. And we have Chris Boyle from the StandbyU Foundation, who's going to talk about an exciting partnership with the Westfield Shopping Centre that's making a difference to local families. And these all align to some work that NAPCAN is doing in Queensland to develop a Child Protection Prevention Alliance, which will be launching soon. Then it joins other alliances that are across Australia to help build a wellbeing and primary prevention alliance strategy for the country. So we'll have an opportunity to talk about a range of topics. You certainly won't get webinar fatigued, and fingers crossed we'll have some time for questions at the end. So without any further ado, I'd like to introduce to you Judge Andrew Becroft. He is the New Zealand Children's Commissioner, but he also deserves a special thank you for agreeing to be part of this webinar at quite short notice due to some unforeseen challenges from our other guest speaker. We're extremely grateful that someone as busy as Andrew was able to be so flexible and accommodating, so thank you. Also, Andrew will be part of another NAPCAN webinar on Thursday with some other children commissioners from across Australia. We think that next year we might name the National Child Protection Week to Australasian Child Protection Week to make the links between our brothers and sisters across the river. I've seen a couple of YouTube clips from Andrew presenting on his commitment to whānau and tamariki, which is families and children. And in a traditional welcome, kia ora to you, and thank you for joining us today. And know that you're going to be inspired. He has an impressive biography, but I'll let him start so he can talk to you about some of the work that he's done. Welcome, Andrew.
Tēnā koutou katoa. Thank you. Welcome to you all. He pai, it's good. Ki te kōrero, to talk. Kia koutou to you, I tēnei rā today. I want to start by actually wearing a t-shirt. That's maybe slightly unusual, but I'll put it on. And the question I want to ask you is, who is it, and where is it, and when was it? And if you have the handout, you'll know. This is the t-shirt, and there it is. Most of you will know that's Dr. Martin Luther King in August 1963 in Washington, in the famous March on Justice. To cut a long story short, he was the final keynote speaker for that vast crowd of nearly 500,000 people. And he had a keynote speech that had been prepared for him by his speechwriters on the theme of a blank check being delivered to the black people of the States. And 9 paragraphs into that prepared speech, you can see it on YouTube, he paused, and clearly he thought he wasn't engaging with that vast crowd. And in the silence, and on the prompting of one of his advisors, a black gospel soul singer, Mahalia Jackson, he repeated a speech he'd given 3 months previously that hadn't caught on, the I Have a Dream speech. And it reverberated down the decades, reverberates today. Children learn it, where black and white children can sit down together, he said, on the sweltering plains of injustice of the Mississippi Delta. So my first question is, what is our vision for children of Queensland? I mean, we've been establishing that vision in New Zealand. What is it that we could summarise and we want for our children? Our Prime Minister has said she wants New Zealand to be the best place in the world to be a child, and she's made that crystal clear. In fact, I was challenged recently to think about a particularly New Zealand vision, and I've got another t-shirt, but in the interest of time and technology, I won't put it all on, but I'll just hold it up. That is Dame Fina Cooper, a very well-known New Zealand leader of last century, and she started a land march. And one of her rallying cries was, take care of our children, take care of what they hear, take care of what they see, take care of what they feel. For how the children grow, so will be the shape of Aotearoa. And that threefold challenge, taking care of what children hear, see, and feel, I think that's a terrific starting point for a New Zealand vision. And we're talking, I guess, today for us, what's a focused strategic starting point for New Zealand children? So, you know, we have, out of a population of nearly 5 million, 1.2 million children. It's about 23% of the population. It's a group that is often not heard from, certainly don't have a vote, and their voices are crucial. I'm often asked, how well do our children do in New Zealand? A very easy summary is to say 70% live in relative economic and socio-economic advantage, instability. Some do well, world-leadingly well, win bronze medals at 16-year-olds at the Winter Olympics. we can be pleased and reassured in New Zealand that so many do so well. But there is a but. 20% live in significant disadvantage. They do it tough. Their families are struggling. And 10% live in chronic, intergenerational, permanent disadvantage, as bad, if not worse, as any in the OECD or Western world. And that 70-20-10 is a really good summary of how well New Zealand's children do. Remarkably accurate across many fields that we measure, whether it's health, whether it's child poverty, whether it's educational achievement. The thing to note about New Zealand is that it's not the country of the 60s and 70s, which regularly appeared in a group of 5 other countries, including the 3 Scandinavian countries and Switzerland and New Zealand. We were always right up there, but we have a long and significant tail of disadvantage in New Zealand, significant gaps and divide, almost a bifurcated children's environment, where while many do very well, some are in absolute profound chronic disadvantage, where Māori and to a lesser extent Pacifica are disproportionately represented. I guess the challenge is, how can we do better? For New Zealand, how can we particularly focus on that 10 and that 20%? And I guess all roads lead back, in my view, to 3 things: child poverty and disadvantage. We could talk about that as a separate conversation. To the lack of coordinated good early intervention across government, across community, across business. And thirdly, the enduring legacy of colonisation. And the C word is still controversial in New Zealand, but that enduring disadvantage from the colonising process plays out today together with modern systemic bias and racism, which is a lethal cocktail. So in the context of those 3 issues, New Zealand thought long and hard about how we could develop a child and youth well-being strategy. Well-being is something of the word of the age, almost the spirit of the zeitgeist, well-being. It's a hard word to define, actually. We looked far and wide, but apart from some states in Canada, we couldn't see too many models that we thought were effective. What was really interesting is that legislation set out that a child and youth wellbeing strategy was required by the government of the day, but, and this I think is the exciting thing, it could not be developed or released until there had been consultation, meaningful consultation with children and with the Māori community. And this office had a great opportunity to hear from and work with children and young people in setting out what was their priorities. What was really interesting is the initial thinking behind the child and youth wellbeing strategy was expressed in the absence of negatives, that is, free from abuse, free from poverty, free from poor educational achievement. And it was, in the words of some of the children we spoke to, a bit of a debuzz. They said clearly that they wanted positive statements of affirmation and vision. And it was terrific. Their message was loud and clear. There is now, as from August last year, a child and youth wellbeing strategy. That's it there. In it, there are 6 key domains or areas that need to be focused upon and looked at. And I just thought I'd briefly tell you what those 6 were. And you can see they're all expressed in much more positive language. Just holding it up, you can better read better than I, but that children are loved, safe, and nurtured. And that's the domain that looks at abuse, neglect, have what they need. That's the domain that looks at child poverty. Happy and healthy, child health. Further along, learning and developing, education. They were the big issues that the government looked at, but because of speaking to children, there were 2 more that were added, and I'll hold them up. One was to be accepted and connected, and the last one was to be involved and empowered. So those 6 domains formed the basis of the Child and Youth Wellbeing Strategy. That's all set out on the handout that I've given you. We've set out what were the guiding principles, and we heard pretty clearly from children and young people some clear messages. Just to conclude, those messages were: accept us for who we are and who we want to be. Life is really hard for some of us, that 10 and that 20%. Thirdly, to help us, help our whānau, our family, and our support crew. Fourthly, we deserve much more than just the basics. Number 5, how you support us matters just as much as what you do. So that's just a little snapshot. The handout says more. You can access the website. You can find out about the Child and Youth Wellbeing Strategy. There are about 76 different action plans across 20 government departments. What's great about it is that it's explicit, it's measurable, it's cross-department, it involves government and communities, and it's visionary rather than the absence of negatives. Too early to tell what fruit it will deliver, but it's one of the most effective, I think, and forward moving steps that the government has had. It means that we can measure child poverty. We can measure whether that is reducing abuse and neglect, because in all the areas we measure in New Zealand, there's a clear, what you would know as a social gradient. It increases, it gets higher and higher. Not doing very well here, am I? It gets higher and higher as the quintile and decile gets poorer, whether it's abuse and neglect, whether it's accidental injury and hospitalisation, whether it's educational achievement, even new suicide. There is a clear social gradient. So by way of introduction, do strategies work? Well, we know this: it does galvanise action, it does provide measurable outcomes, and it does provide the opportunity for coordination. But in New Zealand, unless there's some pretty bold and big fundamental change, I doubt whether we'll really shift that 70-20-10. That is the challenge. But so far as it goes, our Child and Youth Wellbeing Strategy is a good start, and it's encouraging, and we'll keep you posted. Tēnā koutou katoa.
Thanks so much, Andrew. We really appreciate that. And now we're having a few questions coming through for people to ask, but we're going to hold those until the end so we get all our speakers the best chance to have an opportunity to speak. So we'll come back to you towards the end. I'd like to now welcome Professor Sharon Goldfeld. Sharon's from the Murdoch Children's Research Institute in Melbourne, and she's a theme director for population health and co-group leader of policy and equity. She's also director for Centre for Community Child Health at the Royal Children's Hospital in Melbourne, as well as a practicing paediatrician. Sharon's also going to be speaking at the NAPCAN webinar tomorrow, Wednesday the 9th. So if you're really excited and interested in this topic and you get another opportunity, which I suspect you will be, please sign up for that webinar tomorrow as well. I've seen Sharon's presentations on YouTube, and her depth of experience and balance of policy, public health, and using evidence in the context of scenario testing is extremely interesting, and particularly in the context of things like the impact of COVID-19 on children. So it's wonderful to have Sharon with us here today, and thank you for joining us. Over to you, Sharon.
Thank you, and thanks so much. I'm not sure if I can share my screen. Oh, here we go. So let's see if some miracle happens. So before I do that, I might just start off with a couple of things. First of all, I too would like to acknowledge the traditional owners of the land on which I'm standing on, which is the Wurundjeri people of the Kulin Nation, and to pay my respects to elders past, present and emerging, and particularly pay my respects to any Aboriginal or Torres Strait Islander people across Australia and New Zealand, which is exciting, here on the line today. I also want to thank the judge for his great presentation. I did for a moment there think he was going to take his shirt off and put his t-shirt on. I thought, well, that's a big moment. But no, he kept it nice, which was very reassuring, but also a really lovely segue to reminding us about vision. And I think what I'm going to talk about is going to be a very nice segue from the very visionary work that I think they're doing over in New Zealand. So I'm hoping you can see a screen, and I'm hoping somebody will tell me if you can't, but I'm hoping you can see a screen with a child getting an immunisation. I'm going with yes. This is, I want to start with a kind of broadest idea. So previously we just talked about the idea that we have social gradients, we have inequities. Essentially we have preventable inequalities between children. But there's one area that we don't actually have these inequalities in Australia, and that's our immunisation rate. And I want to start with this because there's a really interesting story behind it, and it's a story for the times actually. So Michael Woodruff was a politician. Many of you will recall the name. He was a health minister in the government back in the 1990s, and he came in saying, my one thing I'm going to do, or actually a couple of things, but one of the big things I'm going to do is I'm going to improve immunisation rates. And he set out with that kind of political imperative to address what was then a sense of a bit of moral outrage, like how is it that we can have some kids being immunised in some areas and not other areas? And so he set up a few things that I think are really good lessons for us. So he, first of all, he created this political imperative, and then he created a policy imperative. And he set up a data system that allowed us to really, really understand what was happening with immunisation. We knew which kids were immunised and not immunised, and everybody knew. And the other thing was he was totally looking at how you adapt immunisation in context. So down at the community level, how do you get different people doing these immunisations and address some of the problems, like with immunisation, you have to have a cold chain. So how do you actually address these issues? And then how do you disrupt the way that we do things normally? So normally it was medical or nursing, but actually it wasn't going to make sense unless Aboriginal healthcare workers could give immunisations, or that local government could be actually the purveyor of those immunisations. And suddenly we had this way of disrupting things that enabled us to look at immunisations. And in fact, we just have extraordinary equality in our immunisation rate. So I want to use that as an example of what can happen when the stars line up and when it's possible for us to say, we think this is so important that in fact we can engineer the entire political policy and local context to deliver on something that's really, really important for children. And in Queensland, one of the challenges that you've got at the moment, if I could make this work, one of the challenges that you've got at the moment is looking at your ADC results. So this is the Australian Early Development Census. And in fact, the children who are developmentally vulnerable on one or more is around about 25% or 25 point something percent. And the Queensland government has committed to dropping that within 5 years or 4 years now to 22%. So this is actually a slide that a colleague of mine, Giselle Olive, who's a Queenslander local, shared with me, because actually to do that, if Queensland keeps doing the same things they're doing now, will take about 96 years. And we probably don't have that time between us, but it's a really interesting wake-up call to go, well, hang on, how do we act in a more disruptive way? And in particular, and this is my next slide, which I've been used before, how do we do slow system change fast? And I want to start at that kind of system level and then bring us right down. Because if we're not thinking about systems, we're probably going to get stalemated in the way that we might make a difference for children. And one of the exciting things about NatCan is they're thinking about these prevention systems for children. Because if we're not thinking about those prevention systems, we're going to come straight into the funnel too quickly, and we're going to end up thinking about how do we get more ambulances to park at the bottom of the cliff. And what we really want to do is get great fences at the top of the cliff. So the question is, how do you do slow system change fast? Just like a pressure cooker can do slow cooking fast, how do we do slow system change fast? And this is not easy. But I would argue there are a bunch of accelerators and catalyzers that can move systems along quicker, and I want to share some of those with you today. So the first thing is there are no silver bullets. So we need to move away from single interventions or single approaches and going, well, if we just do that, even if we do it fabulously, are we really going to fundamentally make the difference to kids that we want to in this complex 21st century and now post-COVID world that we're going to be living in? And the simple answer is no. Silver bullets, we need to just move away from that. We need to be comfortable in complexity. The next thing is this idea of working at the boundaries, and this is a seam, and the idea of being disruptive at the seams. So the analogy I always use is if you have a piece of material and you try and pull it apart, you really can't. But if you have two pieces of material, say health and education or health and social care, and you try to pull them apart at the seams, then maybe you can be disruptive at those interface seams. So the challenge I think we put to each other are, how do we be disruptive at those seams? Thinking about the system as a whole, and then thinking about how we might be disruptive at those seams. For example, one project we're doing is asking our well childcare nurses and our maternal child health nurses to ask women a whole set of questions around financial stresses and then referring them to a financial counsellor. And in all the time that we're working with an NGO for this, in all the time that the NGO has been working, they have never seen a family from a prevention point of view. They always see, they're always the ambulance at the bottom of the cliff. And they were so excited to be working with families before they were actually off that cliff, to look at families who are at risk. So a really simple thing, but a way of really being disruptive at that seam. So as I come down and down, you'll see I'm sort of coming, I've started really big and I'm coming down to this kind of ideas of systems. I want to come down to this idea particularly of how we might move systems at a local level, at a community level. And one of the things I really want to talk about is data. And I'm a complete, I am honest, I'm a data geeks anonymous. I love data, but I don't just love it because data is a great thing. I love it because I'm worried that without the right data, we could go off in the wrong direction. And this is the best analogy I could find, is that we need these lead indicators, because otherwise it's kind of like you don't know the score of the match till you get to the end. So outcome indicators are really important. But without those lead indicators that help us work out, well, what's going on in the system and what are the bit of the systems we want to work on, that will allow us to actually direct ourselves to those outcomes. And the challenge is, how do we get those lead indicators? How do we get the score as we're going along so we know at the end how we got there? So two things I want to talk to you about, and I'm going to talk about this next one in more detail tomorrow. So if you don't like it, I guess you might not come, but if you like it, there's more exciting detail to come. So the first is this idea, The first is this idea of foundational community factors for early childhood development, based on a project called the Kids in Community Studies. And we asked the question, what is it about where you live that makes a difference? So thinking ecologically, as you can see that diagram, understanding the state and federal government and the importance of local government, but then coming down to that, what is it about where you live? And what is it about where you live that helps parents bring up their children, helps parents do the sorts of jobs they really want to do for their children? Because parents wake up in the morning wanting to do a great job in terms of parenting their children. And we came up with these 5 areas that we think, and we now know because we've done more work on it, are really associated with better outcomes for kids, particularly better developmental outcomes. And that is something about the built environment, so the parks, the housing, something about the social environment, how people generally work together in that community, something about governance, how the civic responsibility, etc., works in that community, something about the socio-economic mix in that community, and then finally, something about the services. So it's not only just about the services, that's what we most often think about, but all those other domains are so important. And if we could get those right, if we could get those other domains right, then maybe we can start thinking about what makes for these foundational community factors for children. So an opportunity really to think about those factors and think about, wow, if we could measure those, which we now can because we've got the measures for them, but if we could measure those, that could tell us something about the community we're bringing up our children in, and then might tell us something about the sorts of things we might do next. And it would allow us to be bold. There are some communities in the US that have been so bold that they've actually knocked down housing and rebuilt it. The sort of bold things that will likely make a difference for kids. And just very briefly, if I go to the idea of the services, this is a project called Restacking the Odds. So you see I've gotten us right down the funnel into the services. And Restacking the Odds harks back to that, what I talked about earlier, which is there are no silver bullets. And it says, what about if we could just get 5 things right, where we could build one onto the other's mutual benefit, so that by the time kids got to grade 3, they're on a fundamentally different developmental trajectory. And what if those 5 things were in pretty much every community in Australia and New Zealand, I might add? So things like antenatal care, early childhood education and care, first 3 years of school, and parenting programs and nurse home visiting. And what if we could measure those things so we had a look at the kind of triple bottom line that we know is important, like quantity, quality, and participation? And what if we could go into communities and they could collect those data, and that would really help them heat map where are we going to put our effort? Is it that we don't have enough? Is it that it's actually no good? Or is it that actually people don't come? Or a combination of all 3? And our view is more and more that if we have those data, if we had the community data, the community level data, and we had the service data together, that would help us know where to put our efforts for our kids and would help empower communities so they would know where they will go next. Now, this all kind of sounds pretty complex, and it is, so I want to end up with one slide that I really love. So I'm looking to the US as well. This is Oliver Wendell Holmes, who was one of the Supreme Court judges. And I put this up because it's a reminder to us about where we might need to head together. And that is, I would not give a fig for simplicity this side of complexity, but I would give my life for simplicity on the other side of complexity. So thank you very much. I hope I might join some of you tomorrow at the presentation, and I'm happy to take questions later. Back over to everybody else.
Thank you so much, Sharon. And yeah, thank you. We'll go to questions at the end of the 3 speakers. So I'd like to introduce our 3rd speaker. I'm sure everyone out there has got their minds full. You'll find that there are some handouts, I mentioned that earlier, that are actually on this control panel if you need to access those during the course of this session. So our 3rd speaker is Chris Boyle, and Chris is going to share a little bit of something closer to home. So Chris is the founder and CEO of charity StandbyU, and he's passionate about the power of human connections to create a better and safer world. He's also a Churchill Fellow, and he's been a leader in creating and bespoke solutions for proven technology that makes a difference in some of the more complex areas of children, young people and families' work. But not only that, he's an old-fashioned grassroots campaigner, and he loves to build relationships to make a difference. So with 25 years of working in the child protection and family sector, Chris is the perfect person to bridge the gap between child protection and the community. So he's going to share a presentation he calls Retail Therapy, Reimagining the Role of Shopping Centres in the Community. So over to you, Chris, and thank you.
Thank you very much, Rob, and I'm so glad you couldn't find anything of me on YouTube. So first and foremost, I also would like to acknowledge the traditional land owners of the land in which we meet, both here and in New Zealand. And I also want to acknowledge how Indigenous families have looked after their children and raised them in a safe and healthy manner for over 60,000 years. Given this is a Child Protection Week, I will also forecast the arrival of my children home from school, which may lead to lots of noise coming up the stairs as they raid the kitchen. So I'll apologise in advance for that. Here to talk to you about an exciting initiative that we have been gifted through a partnership with Westfield. Now, most people would be very familiar with Westfield shopping centres. There's not one far from any of us, I'm sure, both here in New Zealand. Not too many of you may be familiar with StandbyU Foundation. I'm going to share a little bit about who we are as well. titling this Retail Therapy, where what we see in this point post-COVID particularly, it's fast-tracked a lot of initiatives, including within the retail sector, where shopping centres are moving away from traditional purchasing to being living centres, about how they create extraordinary places in connecting and enriching the communities of which they're established in. What makes StandbyU different from others that are playing in this space is our steely focus on connections. It's what makes us different, and it's such a simple message. We often talk about systems responses, and I've certainly been around the world and looked at those, and we often look at this through the lens of what we are in our professions. We want to put that focus about how do we draw families back into the solution to ensure children are safe and well cared for. My discussions around the inception of this centered around hundreds, if not thousands, of conversations with women and children who are vulnerable, sitting around kitchen tables. And they tell us that the only place often that they could go to without being questioned by their partners is the shops. So there's something that they're telling us that works for them. So we've listened, but more importantly, we've acted on that. The two major partners within this initiative is, of course, StandbyU Foundation. We are working with families across the child protection, child sexual abuse, and domestic violence sectors, and we work with those services who work with the people. So all of you out there who are funded to work in that space, we want to engage with you to see how we can do safe and connections different. What we do is really invite in that safety plan from the form to the function by drawing in those networks and really bringing them into the solution that allows services to gain better traction because they're walking in with someone. The Centre Group people would know they own and operate the preeminent portfolio of living centres across Australia and New Zealand. The Centre Group run a Local Heroes program which awards successful communities, charities working across their centres, $10,000 to continue the work that they do. So we were fortunate enough to win that last year. And again, we're nominated this year to put $10,000 across to those women and children we work with. This is the first time in the Local Hero partnerships that this has evolved from a transaction to a full-time relationship. So we're really honoured to be part of that. The what? Magnolia Place is the name of which we've given this initiative. It was deliberate because we didn't want a stigmatising site that women or kids may be looking over the shoulder, worried about someone who might have seen them walk in. So we're really important about a generic brand around that. But this initiative will be the first of its kind across Australia that allows a really soft entry preventative space for the 8 million visitors in Westfield Helensvale to simply walk in, and it's like a connected communities hub. So what we're looking to do within that space is to invite service providers across the entire child protection and domestic violence sectors to utilise that. So for once, we don't need families to visit services. We will have the services visit the site that families naturally can come to. So the kind of things that we're looking to do on a rostering basis to invite services that might do counselling, free legal advice and support, financial literacy from the banks that exist on site, tech and car debugging, some of the first 1,000 days from a child, wellbeing lens, our StandbyU Safety Shields, which is actually giving those women and kids tangible safety watches program to their networks that we can deploy within 15 minutes. Emergency relief through drawing in Woolworths, Coles, Aldi to provide hampers and packs that gets families to tomorrow. Donate your data through other corporate partners like Optus that we can give them. Everyone needs data these days to be connected. And of course, assistance that people might require in navigating government agencies and Centrelink. So this will be a real hub where people will come in from a community development model, tell us what it is that they need, trying to draw on that data, which Sharon was relating to, is so important in shaping funding and policy, and then us going out to help build it and bring it in that space. So whilst we have Magnolia Place as the first down at Helensvale, we are looking to do this as a national framework and a strategy. For those who like a visual, I'm giving you the design drawings because it is currently being built as we speak. So what we can see is little areas. It's a soft entry concierge type space where we've got kids areas, interview rooms for more closed type discussions and sessions, couple work computer desks and communal hubs that allows, you know, people just to wander in and then slowly creep their way to where they feel comfortable after, we know it's not going to be the first time, but multiple visits across there. We have got all of this designing and fit out done for us in kind, which is just amazing, and it saved us probably about $100,000. So as a social worker who is going through my first tenancy leasing agreement, I hope it's my last, because I certainly don't want to navigate through these, but we have all been told how astounding it is that we've got this opportunity with the Centre Group, to which we are extremely grateful. The why is important, and I don't need to harp on this too long because you're all working in this sector, in this system, that we know that the rate of abuse across our communities has never been higher. It's continually growing. There's a reliance on repeat services where we're getting stuck in cycles because we can't see them through to a conclusion and close the loop. That their eligibility often is what determines whether they can be engaged with services, and so do funding agreements. And of course, who thought that this work would be even more complex than what 2020 has delivered, with the COVID-19 creating both a risk at the home and social isolation and vulnerabilities has never been greater. It is actually time that we need to do things differently. Nothing changes if nothing changes. So how do we actually start to embed ourselves in naturally forming places to deliver services in a preventative lens to children and families? Prevention, as we know, is better than cure, but for many people, they will struggle and they will just never access a service support. So safety and prevention, it's not just about those words, it's about people, actually, and there's a story behind every number. So we need to understand the context in which families live. So there is that shame and embarrassment and fear and judgment, and people who are worried about other family members or friends may not know what to do as well. So it's about supporting those people in a responsive way, that they are able to intervene in a way that actually engages those vulnerable children and families. The where, this is Westfield Helensvale. So this is the site of which we will be located. The problem down at the Gold Coast is, unfortunately, it owns the title of the domestic violence capital of Queensland. You can see on this diagram the 3 top suburbs for domestic violence centre all around the Helensvale site. So this is a natural place for families to be able to come and access services and supports. We're not hidden away in a corner somewhere. We are not trapped away. This is in plain sight. So we have an external facing entry amongst the other 170 retailers that we are going through to engage all of those people to say, what can you do for families that step into Magnolia Place, such as half price or free haircuts, you know, for kids and for women and for families, clothing that might be on the discount shelf that we can bundle up, just trying to ease those pressures that families are feeling at any time across any context. The how, I mean, one of the things that we really want to focus on is we've got a really complex system, but in essence, we've almost made it more complex than it needs to be. We want a really simple model about how we draw in true partnerships into this, that build awareness but inspire action, that allows these drop-in centres to be form of a bit of a heartbeat that doesn't do all the work there, but it's a touch point where caseworkers can come into that space, visit their families, have a cup of coffee, families leave without having to get that knock on the door from the service provider, you know, trying to coordinate when there's a good time. What we do as well as part of our aspect working with those services is try and embed our StandbyU safety shields, which looks to lock away safety for those vulnerable children and women by giving them these devices that they never pay a cent for. What we need to do through a vision and a framework is give those people, those families, the support they need to build connections. That once we can reduce that isolation and strengthen communities, a lot of the things we will never see come knocking on our door, because families have actually got this, like they have for 60,000 years across our countries. For us, we truly believe that it's connections that change lives for children, young people, and adults. It's important to measure impact. So we've had a trial, and why we've got this site down at the Gold Coast is having a relationship with the executive leasing manager and running a federally funded trial down at the Gold Coast. We've really picked up on some of the nuances that exist down there. Impact for us is the most important measure. And what we're hearing is children and women are now having agency in their lives. If they can find connections within their space, they're happier to go out. Even an 8-year-old has learned to ride her bike since COVID, because there was a fear of the curtains closed, doors locked, of something lurks on the outside of these doors. And that's the perpetrators, let alone the system's responses, which is often highlighted by arrest, report and remove when that knock at the door comes from someone that they don't know. The when. We are 6 weeks from opening, possibly even less. So we are heavily moving towards this, and it will officially open on the 15th of October. So we are rallying around the service providers down there. And if anyone on this webinar is engaged in doing work down at the Gold Coast area there, please reach out, because we'd love to hear from you about how we can engage you and your service for those vulnerable families. The goal for us, it's always important to have a vision. We believe that we can connect 1 million people by 2025 through building connections that connects those at risk to those who care, including those children who we often do this work, but we want to concentrate on the relationships of who will be in your photo in 10 years' time, not the services that surround you now. And when we can build connected communities together, we can truly prevent abuse. And I will leave it there. There's some more information on us after, but I will do that for timeliness so we can get to some questions. So thank you for your time and attention.
Thanks so much, Chris. Now, I believe what we have about approximately 10 minutes, and we've got all our speakers now going to be coming through, and we'll have an opportunity for questions to each of them. Whilst we're waiting for the other speakers to join us, Chris, I might start with a question for you. So this has come through. Somebody's asked, this is a great initiative and seems like a fantastic opportunity that Westfield are contributing. Is this something that they're planning to do in every Westfield?
Yes, certainly as part of this, of course, you know, what we wouldn't be surprised is there's been a lot of managing up and messaging up around this. So this has been about a 8-month piece of work to get it to this opening. So as part of that, Westfield executives are looking at this at a national and New Zealand framework about how this may be rolled out into other sites. We are looking to run some measurements and data around this. What I didn't mention is the generosity of Westfield in this space is we've been gifted this site at $1 a year for 3 years. So it's when we move from corporate social responsibility to true partnerships, this is Westfield putting it on the line, saying we need to stand for something. And it's through relationships with Isaac Kergerman, who couldn't join us today, but he's made this miracle happen from internally in Westfield. So we hope to be at a postcode near you shortly.
Thanks, Chris. All right, I've got a question here from Amy for Andrew. Question is in relation to, you've talked before about New Zealand and that you had a second chance for revolution and change. If you could start a new revolution around children and families in Australia, given what you know, where would you start?
Oh, to be a brave Kiwi who'd make any suggestions to an Australian. For us, it may have resonance. I think in terms of care and protection services, we have to have a new vision and move towards by Māori, for Māori, with Māori delivered services. Given that nearly 70% of those in care are Māori, or Māori/Pacifica, 70%. That's over 4,500 kids out of this, over 6,000 in care. I think inevitably we have band-aided and tinkered around the edges with our care and protection system, but it hasn't, in my view, successfully delivered for Māori, and we must move towards a community-driven, ground-up, by Māori, for Māori process. And I think, coupled with that, there is the seeds of real hope in the child poverty national reduction legislation. That act sets an obligation on the government today to set key targets in respect of 4 measurable primary measurements, 6 secondary measurements. I believe the tentacles of child poverty reach out into all areas of a child's life. If we could crack the child poverty issue in New Zealand, that didn't grow slowly, it happened bang with the global financial crisis of the late 80s and a government response that really gutted benefits, and we never recovered. It went straight up and then it stayed pretty much the same. I think by Māori, for Māori approach and halving child poverty in 10 years, as is the goal, is a great start for New Zealand. And I think we took child poverty too lightly for too long. We were asleep on the wheel. For 30 years, successive governments did nothing. We did great in New Zealand for the elderly, over 65s, second best looked after cohort in the world. But under 18s, we just were asleep at the wheel, and the burden and the structure of our economy is all wrong, and the burden falls on children. And the tentacles of that poverty flow out into all areas of a child's life. So I'd start with child poverty reduction, national focus.
That's great, thank you. Sharon, a question for you. If you could change one thing only in the child protection and family prevention space, and particularly something practical, what would that be?
Oh, that's a really hard question. I've just banged on about no silver bullets. So I want to talk about these upstream determinants and the ability to be brave. So some of the things I'm not sure we're quite brave about is thinking about how we might use social determinants in a really pointed way. Am I echoing for everyone or just me?
No, just you.
Okay, not sure why. I'll just try that again. So I would go with what we can do around housing. And I know that kind of seems a bit left field, but if I could do one thing, if I knew there was a woman, any woman, who was being notified for their child, so child protection in pregnancy, I would try and give them 2 years worth of free housing. And this kind of goes to the poverty thing, but actually a bit more pragmatically. And that's the sort of stuff I would be thinking about. Now, I'm not suggesting if we just did that and then the world would be a better place, but I think those sort of bold ways of thinking about how we might think about child protection are the sorts of things we need to think about. I need to tell you also that we've just finished a project through a PhD looking at healthcare access, and pretty much there's a sort of framework of what healthcare access, child protection is supposed to, kids in child protection, particularly out of home care, is supposed to get. And out of 6,500 children we looked at, 0 to 12, there were 16, not 16%, 16 children who actually received healthcare according to that national framework. So there are some, it's not like, oh, this is a tinkering at the edges. There are massive things that we could do right now. All of that's pretty fixable. You know, we could get healthcare with, they belong to the state. So that I think that, I know that's 2 things, Rob, so I cheated, but I think there are two things, one a bit more radical than the other, where you're going, let's address some of the kind of elephants in the room head on.
Okay, that's fantastic. Now I've got a couple of questions that are coming thick and fast. We're not going to get through them all. So I'll do a question, this one for Sharon and Andrew. In terms of the partnership example that Chris talked about and philanthropic or corporate social responsibility, do either of you have any examples you could talk to in the primary prevention or wellbeing space that you think are great success stories?
For corporate social responsibility?
Mm. We can't hear you, Andrew. Andrew is.
I'm now unmuted.
Yep. Thank you.
I do think the government has the fundamental responsibility to erect a safety net. And in New Zealand, we abandoned that responsibility for children in 1991, where benefits were unhinged from wages, huge wage and economic growth. Benefits have never made it up. So I do think the government's got to start, but it's not the only thing. And I think there is one great example in New Zealand, which I'm learning more about, mana whānau, the strength of the family, where it is said in 2 pilot areas, 86 children have avoided being taken into state care. So that's involving the philanthropic sector and community groups working together. And I think up and down the country, they are what work best. We haven't been that good at involving business, but we could. But I think what Chris mentioned is a great challenge to us, because it is seen too much as being the domain of the philanthropic sector with community groups that live on the smell of an oily rag. But I think businesses are up for it, and I think it's an untapped resource in our countries.
And I think in Australia,
we've got about 4 minutes still to go, so I might just get you to do one final sentence. Just keep it to one sentence only each. Wrapping up your key message that you want to take away for the people who are listening today. Maybe we'll start with you, Chris.
Oh, that's a tough one. I think for me, it has to be connections. Connections change everything. I think service providers play a really important part in connecting those vulnerable children and families to either those in that genogram, in that family tree. There's always someone who, once they know, will care and act to look out for them and provide that scaffolding and support. And I think services, if you do nothing else within case plans, if you find that one person, that one significant other, then you've done a great job.
Sure. Thank you. It's going to be 10 seconds, Sharon, and then Andrew.
Really quick, every year about 250 to 280,000 babies are born. About 11% of them are going to do not so well by the time they get to school. It's going to be 3 times the difference between the poorest and richest areas. And if we don't do slow system change fast, we're going to squander another 10 years worth of effort on children. So we need to get our skates on.
And Andrew.
Taking the more visionary starting point, focus on the 10%. Government must step up, but work with philanthropy, community, and business. And that 10% must involve increased government support, housing, huge issue in New Zealand, and adequate access to health. I mean, we have the scandal of high rheumatic fever rates in New Zealand. They're all preventable. It ought to not to be this way.
Brilliant. Look, we have 1 minute to go. I have to say that was an absolute jam-packed information hour, and I know that myself and everybody online could have done that for another 10 hours. People will be well and truly going off to the other webinars. I'd like to thank you very, very much for your time today. You're extremely busy people, and to have the opportunity for your insight and wisdom is fantastic. I'd like to reiterate, this is not the end of the conversation, so we'll be following up with our participants and with our presenters today with more questions, more emails. On your documents there, the go-to site, you can see there's some resources that you can access that have been shared by each of the presenters. It may take a week or so for the NAPCAN team to pull it together, but I'd like you to all please join me in thanking Andrew, Sharon and Chris, who've done an incredible job weaving together their ideas and thoughts for change. And we have webinars running all week, so please have a look at the website, register for those others. And to finish off, I was reading a lovely quote in the report this week, and it said, "Please don't ask me what's the matter with me, ask me what matters to me." So as we finish today, I think thank you for your time. Go forth and listen to those children you connect with to give them a voice so that they can talk about what matters to them. Well done, everybody, and have a great day.